Hello, here with me is Dr. Davor Moravek,
Hello.
a respected psychiatrist. Please, Dr. Moravek, tell me something about yourself.
I'm Davor Moravek. Recently I'm working in the Netherlands in some outpatient care with social psychiatry ambulatory treatment for people with mostly dual diagnosis, but a lot of them also with psychotic problems. I have experience with social psychiatry, biological psychiatry. Well,
Mm-hmm,
in two
mm-hmm,
different systems, Croatia and Netherlands, and I could
mm-hmm,
compare
mm-hmm,
actually what work and what could be better.
mm-hmm. Okay. One is diagnosed with schizophrenia. In what way one should change her or his life and why? Or is it
Well,
any change necessary?
yes. Well, schizophrenia is first lifelong chronic disease,
Mm-hmm,
and it is not easily diagnosed. You need some time to be diagnosed, and you have to have symptoms for more than a year or so.
mm-hmm.
And what changed in the
What
life
one should
that
change about his or her
well,
life?
what one should change? Firstly, what is changed because of the problem is that if not treated, schizophrenia could lead to complete chaotic disorganization of someone's life.
Mm-hmm,
Uh, Firstly, we have positive and negative symptoms.
mm-hmm,
What is positive symptoms is well known and seen. Somebody could see changes like visual illusion of hallucination, especially in the beginning, change of character, change of mood. But what could be abrupted and for sure, what is a greater problem and typical for schizophrenia, but not other diseases, is negative symptoms. Negative symptoms means that something is missing. So if somebody miss emotions or someone miss ability to think clearly, or if somebody lack the usual things that feel pretty well, somebody could ali- somebody could alienate themselves from the other people
mm-hmm.
and isolate himself and live in own world. And what therapy try to make is to makes someone whole again. What is the meaning that somebody is whole again? That enjoy what was uh, pleasurable before,
Mm-hmm.
or to be able to live as normal as possible.
Mm-hmm.
And that's the biggest change, just to live normal life. But to
Okay.
achieve that, they need
From the patient
to
point
make
of
a lot of
view,
effort.
I understand the therapist point of view, but from patient point of view, how we can make some changes in our life, like in sleep regulation, or devote some time to some activities which could uh, uh, let's say make this negative symptom less or prevent hallucination. What one should do from as a patient?
Yes. Well, first is First thing first, you need to start with um, normal activities and keep on going.
Mm-hmm.
Keep on doing what is pleasurable, avoid what is not. But here is the biggest problem. Schizophrenia is one of the symptoms is a lack of control, meaning somebody could not control perception. Then try to avoid perceptionally overwhelming. Why sleep? Well, sleep is natural way that we recover from everything that happened during the day. So if you don't have enough sleep and not enough good sleep, you don't have enough chance to be able to recover from what happens during the day.
Mm-hmm.
And that overwhelming with everything that happens make the life unbearable. Well, the second thing is be in movement with to walk or to do
Yeah.
something physical, anything, because if someone think too much and is not able to be to think what's the best, just doing help. So what they should do, just try something. Try repetitive things. Yes, it's very simple, but if it is too repetitive, well, it's also some kind of avoidance of challenges. But if
Mm-hmm.
there are less challenges, then there's a less chance to, well,
Get
develop.
psychotic
But
episode or so. So,
yes,
uh,
psychotic episodes also.
mm-hmm.
That's why we need good rest and good activities,
Mm-hmm.
just to be less just to have less unpleasurable outside experiences.
Mm-hmm. Uh, what do you think? What are the restrictions, generally speaking, for people with schizophrenia?
Well, well, people should know those people have episodes. Sometimes they don't feel well. Sometimes they need rest. Sometimes they need sleep. Well, the episodes could last for a few days, few months. And during the day, they are not able to fulfill all than what they have in remissions. And
Mm-hmm.
for them, that's a pretty big deal because when you are not, you are sick and it's not just cold for a few days. And if the other people don't understand what is happening, someone could think they are lazy or not try enough. And during those periods, those people should not uh, make too much contacts with others and with too much stress.
Mm-hmm.
Those moments are when stress is not desirable. And
Mm-hmm.
that's, well, that's what a lot of people with schizophrenia actually experience. Stress for them is sometimes too much.
Mm-hmm. How antipsychotics works, or can much improvement can be made by psychotherapy or some other spiritual activities, or perhaps?
It's a great question. Well, we have spiritual activities for, well, 2000 years or
Mm-hmm.
more or less. And during the time, the movement therapy or work therapy, it's known for more than 2,500 years, and it certainly could help. But for some people with schizophrenia, we have chronic deterioration. The meaning of the word itself is that they are, well, aging too soon with cognitive abilities. That's the meaning of the name. So that's actually very important to keep the pace of life. Of course, some spiritual activities for some, or praying for the others, or moving or keeping busy with physical job. That's
Mhm.
great. But
Mhm.
what actually changed with the invention of antipsychotics 80 years ago is that we are now able to stop the deterioration. If they start with medication pretty soon, and
Mhm.
if they are diagnosed on time, then we have chance that they will miss less of their abilities than before.
Mhm.
We have very powerful medication, well, maybe 70 years, but every next generation of antipsychotics
Mhm.
make less side effects. What's the problem?
Mhm.
Uh, Old school antipsychotics are very powerful and could help them to be almost completely normal. But if they have a problem that other people could see, they have a problem with movement or the size, well,
You
like a
mean
stiffness,
involuntary movement of legs or something?
ambulatory movements, well, such kind of things are not nice, and other people see that something is wrong with them.
Mm.
That's the problem, how the other people see them. Newer
Uh,
one make less movement problems or
mm.
involuntary movement. But the second generation, also very powerful, could make metabolic problems. So they say, oh, I will not take a medication because that make me dick,
Right.
or they make me
Mm.
have diabetes, or because of that I have other problems with the liver or my
Mhm.
high blood pressure. So that's actually the big problem. And with very developed treatment, therapeutic teams, nurses, doctors should monitor that and try to minimize those kind of side effects. The
Mhm.
last generation, the third generation that is available, especially in America, about last 5 or 6 years in Europe,
Mhm.
US, have lesser and lesser side effects. So it is pretty important that we try with the more efficient, but also medication with less possible side effects to
Mhm.
make the quality of life
Psychotherapy, yes or
high.
no?
Yeah. Well, psychotherapy, well, some of my teachers was able to keep people with schizophrenia in remission just only with psychotherapy.
Oh.
But it depends. In some periods with acute episodes, uh, old school psychotherapy could make more damage than help.
Mhm.
Uh, Psychotherapy that's concentrated over the stress, over the peace of mind could help all the time, but go in deep and search inside yourself. Well, it is not good if you have problem with thoughts that are not realistic.
Mm-hmm.
Well, psychotherapy is for remission. Then could help that you better understand yourself, but not for acute phases. You see,
Okay.
when you have acute phases, first start with medication.
Okay.
You know, when you are
There is a
better,
big,
then
yeah, the
yes.
problem with schizophrenia that people are stigmatized, discredited in many ways.
Well,
How
actually, it
it's
is the biggest
going
problem.
today? Should one be honest about diagnosis or keep it for itself? What person with schizophrenia should do about it? Tell honestly, I have a problem. The problem is huge. It's schizophrenia, or
Yes.
keep it for itself.
Well, it depends with whom are you talking.
Mm-hmm.
Well, if you are different, would people accept someone as equal? That's the
Mm-hmm.
first question. You could be different in many ways, but you could accept yourself as is. A big part of stigma is self-determination. We call it self-stigmatization. Oh, I am not able to this, or I am not able to do that. Well,
Mm-hmm.
it's one part of the problem. Other way why people are not accepting, because sometimes they think, I know everything. I could do everything. Nobody could help me. I don't need help.
Mm-hmm.
But other people, if they see that something is wrong and someone is rejecting the help, well, we have different opinions. And what's the best for me? Well, if I don't feel I'm have a problem and other thing I do, who is then the problem? That's
Mm-hmm.
the question. What? But one after a period of time, I made a lot of mistake. Now I try to do something different, but could I? Could I
Mm-hmm.
change? And if I could, should I? And those are philosophical questions. Well, probably, but the the illness itself make people sometimes more lesser nuance with emotions and lesser cognitive capable to judge different stuff, especially if they have inner voice which tell opposites of what they
To
want.
do.
You know, it's the question of will.
Mm-hmm.
They are in doubt. It's a big problem. I don't know what to do and why.
Mm-hmm. I
But
understand.
will happen to anyone.
Yeah. How to grow the empathy within yourself as a schizophrenic person, how to socialize in society, what are the necessary steps to keep the to be part of the society, what schizophrenic person should do.
Oh, a lot of question, and how to be a good person is first. What make me a good person? What make me to be accepted? Well, I should know being accepted is not being manipulated from others. Well, there are a lot of people who could see, oh, he is vulnerable, and they will try to do something about, well, not all people are completely honest. That's the first.
Mm-hmm.
But to see the difference is just choose a few people that they could trust.
Mm-hmm.
Well, normally we could trust people who know us, who know how we are when we are good.
Mm-hmm.
That's the first question. Try to trust few people. Well, you could have a buddy to trust, you could have family members or someone dear, or you could have someone professional. And you know, oh, I could trust them because they are professional and they will do what is in my best interest.
Mm-hmm.
Uh, in Netherlands, we have people who are specially special sort of professionals. People who had experience with illness, overwhelmed. Now they are in recovery, but they know what people in recovery need.
Mm-hmm.
They have also the 2-year study for them. They could be also paid, firstly volunteered. We call them ervaringsdeskundige, meaning something with experience.
Mm-hmm.
And what is here the meaning of that they try to work together. That's how we try to be accepted in society. Let's do it together. Uh,
Great advice.
Second, what we could do is to ask someone, well, if I see the pink elephant in the room, do other people see also the pink elephant? Well, maybe few, but if all see the pink elephant, yes, okay,
There
it's
is a
there.
big pink elephant. Yeah, I understand.
Yes, that's
Mm.
how we try to understand what's real and what's not. What's not. Well, that sometimes what we see is not real, but it's more real than other stuff. That's how we could see what's and how to trust people. No,
Mm-hmm.
ask someone just to give you a hand in the certain moments.
Mm-hmm.
But it's not so easy.
Ah,
Certainly not.
nothing is. What would you recommend a schizophrenic person to live on their own or some community life together or something like that? To be part of the
Well,
family or have a caretaker or to try to be as self-sufficient as possible.
it's a great one because it depends what we are and what we want.
Mm,
Some people are more self-sufficient than the other. If people enjoy living with family, the, the real question here is, could family enjoy living with them?
endure them. Yeah, that's the big
Endure
issue.
them, yes. That's the big problem. Some family, especially parents, could suppress your becoming adult. But
Mm-hmm.
sometimes they're just too much, and
No.
it's normal. But well, to be a part of society, to be a part of group, uh, going to the hospital for a lot of people is just going to the place when the other people understand
I didn't
and
mean
they don't feel.
hospitals. I mean like special homes with people with mental disorder or something like that. I didn't
Yes,
mean
there are
psychiatric ward.
there are so much different levels of how
Mhm,
much is someone self-sufficient and how much they have a help. We have,
mhm,
just acute hospital for episodes. We have
mhm,
hospitals with that allowed a month of or even years to be there. They have just homes nearby hospitals that you could easily walk, and you could have some help with during some social moments. You could have someone who could help you home, well,
Mhm.
daily or weekly, and you can live remotely out of
On your own.
all the system. And some people choose just to live completely outside the system. Well,
Mm.
I don't think it's a great idea, but how much someone want to socialize is a question. What kind of group they feel good in,
Mm.
and it depends on the society, it depends on the family, depend on the,
In
well,
person.
what normality, what's
Mm.
normal.
Okay. Thank you very much, Dr. Davor Moravek. I hope we will talk again soon about some other issues what persons with schizophrenia have. Bye.